Brian Kaufman, I'm having horrible anxiety and am on several meds which are not working. Zoloft, Wellbutrin, gabapentin, and Xanax as needed. I don't want any more drugs. What else can I do? Brian, you are in, you're a rock in a hard place. You probably are feeling like you don't even know what are side effects, what are actually legitimate mental health issues anymore. And all I can suggest to you is to continue fighting and to be brave and to understand that how you feel now doesn't dictate how you will be in the future. You know, it's really easy not to be able to see past your suffering. You're clearly suffering. I recognize the tone of your message. It's one that I've read here a million times. And I just want you to know I believe in you, and I'm sorry you're in pain. And control what you can. I mean, really control what you can, because medications can only get you so far. So you need to have the fortitude to at least keep fighting. Try to keep trying and see what else you can do. Kristen Klausing asks, I'd love to know what your typical day is like. I would really like to do a day in the life video. I've been thinking about that for a while. I should probably get on that. You also ask, what do I know about BPD? What is BPD? Borderline personality disorder. It's a mental disorder characterized by unstable moods, behaviors, and relationships. I know it affects a lot of people, but I don't know anything specifically about it. I'm not a healthcare professional, and it doesn't happen to be something I've experienced. Sophia Rabia, sorry if I say that wrong. What is your favorite color? I'm a big fan of black. I know that's not a color, that's a shade, but I like it. And I also like red and blue. My favorite, gun in my head, red. I should probably not use that expression. Elizabeth Hesby asks, how was your intimacy with your girlfriend affected by your illness and medication? Are you thinking about getting children sometime in the future? Getting children is an interesting way to put that, but I know what you meant. And, maybe on the kids. I'm certainly becoming more open-minded to that possibility now, as opposed to when I was acutely depressed. I was like, fuck that. I'm not bringing some poor little kid in this world if I end up being unstable and I can't take care of him or her. Intimacy with a girlfriend, yeah, there's a paradigm shift that needs to take place in order to survive mental illness with your significant other. The more significant that person, the longer you've been together, I think it improves the likelihood that you can stand the storm. But, I went from being one way, the person that Jessie, my now wife, my ex-girlfriend, if you know what I'm saying, she went from being lover, partner, to caregiver and comforter and almost adult figure, trying to keep me, who just decompensated into a helpless, crying, feeble infant, from giving up. And it, of course, it screwed up intimacy and it screwed up libido. And I don't just mean physical intimacy, I mean emotional intimacy. And so, it was affected tremendously. It was horrible. It was really bad. But we withstood, and it gave me a greater appreciation for intimacy now. And I'm forever grateful that she hung in there. The Answer asks, I have been diagnosed with bipolar 1 disorder and had a conflicting diagnosis of borderline personality disorder and an additional diagnosis of generalized anxiety disorder. Do you feel it's possible that temporary relief of symptoms associated with mental illness can be alleviated with short-term intervention of psychiatric medication as opposed to long-term use of those medications, which is, for the most part, common practice these days? Yeah, of course. I think, like I said, psychiatric meds, they have their place. There are risks involved, and I think full disclosure needs to be 100% the only route for prescribing physicians, but not to get too far off your question, you have to be careful how you come off. I think certain medications, might prove more useful long term. I know there's this thing that happens to some people when they take psych meds where they just feel like they're better and they want off, and then sometimes they can relapse into depression and anxiety. But I think that can happen anyway. It's one of those tough questions to answer because everyone's so individual. I would consult your physician, of course, and then of course I always suggest people attempt as much treatment holistically as possible. Good luck in your situation. I understand dealing with multiple diagnoses, and there's just this feeling like you want to go a certain route, but you're in a lot of pain. There's a lot of instant options available to you, and you just want to feel better. So hang in there. Finding Zeke says, hey Noah, what's up, man? Have you ever been successful at getting off antidepressants? Yes, I absolutely have. But the reason I feel like I was successful getting off is because I identified that one, they weren't working, but two, there was some causation for my mood problems that I hadn't discovered. Mine personally being that I had like no testosterone in my body. And so once I got that adjusted, the tricyclic antidepressant that I was on, the Seroquel that I was on, the mood stabilizer that I was on, they were no longer indicated, or at least so we thought. And so they tapered me off them. I was super scared. I made a video about it because I'm just like freaked about withdrawal symptoms, questioning what if I'm making a mistake. And my psychiatrist babysat me through it, and we got off. And I've luckily, as of right now, not that I think it's a sign of weakness, but I haven't been back on. If I ever need to, I know it's an option. It just hasn't been my story so far. The other question you had is, have I done CBT, cognitive behavioral therapy? Yes, I have. I still see my psychiatrist every 2 weeks for that. And it's great. I think in general, whether or not you have a history and or are currently suffering from mood disorder, addiction, whatever, all of us could use someone, especially as someone that we connect with who has some formal clinical training to guide us through our thought processes, our habits, our behaviors, help us see things for what they are. People who have our best interests in mind and actually can do something about it. So I've had good experiences with it. I personally believe that that's a part of my self-care I cannot let go of. I don't care how stable I ever think I feel. I'm not going to give up seeing someone if I have the opportunity to, and I'm blessed to have that opportunity. So I will continue. Every never is now, hiphopundead.com. Says, this channel has helped me through a lot for the last 4 years with an anxiety. Thank you for the content. Good looking out. I'm glad I could help in any way. My question is, do you watch bodybuilding? I mean, I follow it low-key. I was really into it back in the day. But as I've gotten older, my interests have changed a little bit. And so I keep an eye on it, but I'm not as actively interested. If you do, who's your favorite bodybuilder? I'm very much into the old school bodybuilders. So I definitely like the Frank Zanes and the Lee Haneys and Arnold's day and the Generation Iron era. You also ask, do I take pre-workouts? No, I personally do not take pre-workouts. I mean, I might have like half an orange or something like that. Get a little bit of fast digesting carbs. Last question from this gentleman. How is your overall recovery going since the taper and not drinking? So taper is going fine. The smaller the dosage that I've been on, the better I've done, the less side effects I've felt. Joy Walsh asks, if there was one thing that you could change about something you have done, and I want you to think good and hard about all the things in your life that you've been through and done and wipe it from existence, what would it be? You just had to make shit deep, didn't you, Joy? My natural inclination would be to wipe taking the Vivitrol injection, which was the catalyst for my mental breakdown. I've often thought, man, if I could take that shit back. But once you get stable, it's a little easier to go, maybe everything happens for a reason. And so maybe it does. No, see, you know what's weird? Every bad thing that I've ever done has usually led to some greater appreciation for XYZ, some greater sense of XYZ, more respect for I usually learn. I'll tell you one thing, actually. This is definitely couldn't possibly be the right answer, but it's the answer you're going to get. My aunt, Carol, had breast cancer a long time ago, and she just passed away from breast cancer because it came back. And when we were younger, and she had to have one of her breasts removed, rest in peace, Aunt Carol. When we were younger, she had to have one of her breasts removed, and I was at her home one summer, and she had this picture of a woman with her arms out like this in black and white. And it was supposed to be an expression of power, femininity, beauty. She had one breast removed. It was supposed to be, it's just the symbolism was incredible. But I laughed. I remember laughing and saying something really mean and giggling with my sister. And I didn't realize Carol was right behind me. I was little. I must have been 9 years old, 10 years old. But I remember that day like it was yesterday, just making fun of this woman who had no breasts and how gross it was. I just said some mean things. Kids say mean things. And, it's interesting, when I got older and I would see her at family functions, that's all I would think about. I just felt so bad because as I got older, I realized how strong she was and how brave she was. And how hard it must have been to go through the cancer she'd gone through, to have her breast removed, and how important that symbolism must have been for her. And here I was, this little piece of shit kid just making fun of it and saying mean things. And so I wish I could take that back. But the counter argument would be that, of course, I have an incredible incredible sense of respect and empathy, and just, I don't know, I'm blown away by the strength that people who battle cancer and breast cancer exude and exhibit, and what they have to deal with. And like I said, she just passed away from it. So anyway, Sir Tid asks, hey Noah, I got 2 questions for you, if that's okay. Number 1, I recently went to my doc's to refill my prescription. He said that the meds I'm on, I should only have to take them for about 3 years to get my brain to reboot itself. Have you heard of anything like this happening? I mean, brains reboot themselves. He's your doc. I mean, within reason, trust him. My second question is, when you're depressed and the things you turned to that make you feel better about yourself don't work, what do you do? Or who do you turn to? You just survive. I don't have a sexy answer. You keep doing them. The things that used to make you happy, I still believe, have like the greatest chance of eliciting some response, even if it's deep, deep within you. You just remember that right now it's survival time, that those feelings will return, and that you're strong enough and you can do it. It's going to be hard, and it's going to take some creativity from you to stay active. And I would focus on staying around people. Anyone who has like emotional weight for you, hold on to them. It's amazing how much learned behavior can just keep you in the game. Sassy Little Frassy, what were the main contributing factors keeping you sober? Good Lord. Fear of mental health relapse. Fear of mental health relapse. Highly fearful that if I introduced anything like that back into my body, my brain, it would eventually lead to my complete demise. And that mindset kept me sober for almost 2 years, just feeling like it was the best thing I could possibly do for my mental health and for my chances of staying alive in this world. And I think one of the most confusing things so far, in this new phase of my life where I've been doing some drinking, is that so far those things haven't been affected. I might even argue that my mental health feels better, and I don't know what that is or what that means, but I've said this to some people, like when I was drinking, or when back in the day when I was drinking too much, I felt suffocated by it. When I got sober, after a certain point, because I still adore sobriety, I still love being sober most of the time, but after being sober for so long, relatively speaking, I felt a little suffocated by that sobriety, and I always wondered, like, if finding the right balance for me personally, the way I am, and what that could mean, would that be preferable? And so I think that's what this exploration is all about. Not that you asked about that. Roger, hey Noah, my question relates to your adopted siblings. Can you share some info on that? I mean, the basic info is that I've got... Sorry, I live with twins. One of them's yelling. He's yelling. Listen. Yeah. Okay. One of them needs soap. Yeah, I've got 4 adopted siblings. Toddy, Temba, Zanel, and Rufado. They happen to be from Zimbabwe, Africa. And it's a really long family history story, but my dad grew up there, and there's a connection there, but it's just too much to get into. No, they weren't initially foster kids. No, my parents adopted my siblings. One was almost 18, the other was 15, 12, and 10, I believe. How was growing up in my household? It was crazy. It was loud. It was full of love. It was full of bickering. I mean, there were like 8 or 9 of us running around, plus my parents, and then whoever else needed to stay at the Hotel de Thomas, as we used to call it. So it was fun. My dad was really big on family dinners. He just felt like it was really important. So even though we were all busy and we were all going to school and into sports and into blah, 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 and my dad's a busy doctor, my mom was a nurse, we always sat together for dinner. We used to say whoever can go fastest might get a bite in terms of serving. It was great. It was a really cool experience, and I wouldn't trade it for the world. Wish I had time to talk about more.